You're searching for a better way in cancer care, relief from suffering, a real chance at a better outcome. It's a journey many are on, and it led you to explore ozone therapy. We're diving deep into this possible alternative treatment that's sparking both hope and skepticism. It's time to unpack the truth behind the hype and see what science has to say.
What I find particularly interesting is the history. Ozone therapy isn't some new thing. It's been around since the late 1800s. Even figures like Nikola Tesla saw potential. Yet it remains outside mainstream medicine. Why is that? That's a question we'll explore today.
We have fascinating sources to guide us, including an interview with Dr. Frank Schallenberger on Extreme Health Radio. He's a proponent of ozone therapy. With decades of experience, he makes some bold claims, starting with ozone's ability to enhance something called mitochondrial function. I know that might sound technical, but stick with me.
It's crucial because mitochondria are the powerhouses of our cells. Think of them as tiny energy factories. When they decline, it impacts our overall health and contributes to aging and diseases, including cancer.
And Dr. Schallenberger suggests ozone therapy can actually reverse this decline. He even shared his own experience of boosting his own mitochondrial function with ozone at age 64. But it gets even more intriguing when he starts talking about using ozone therapy for cancer, sometimes alongside conventional treatments like chemo.
Now, anecdotal evidence, while compelling, needs to be examined carefully. Individual experiences vary greatly. We need scientific studies to confirm if these benefits hold true for more people.
Absolutely. So let's dig into the science. How does ozone therapy work on a cellular level? What's the mechanism behind these claims?
Ozone is a highly reactive form of oxygen. When it's introduced into the body in controlled doses, it interacts with the various molecules, creating a cascade of effects. One key mechanism is the generation of what are called lipid oxidation products. These molecules, as counterintuitive as it sounds, can stimulate the body's natural antioxidant defenses, and as Dr. Schallenberger suggests, enhance mitochondrial function.
So it's like giving our cells a wake-up call, making them more resilient and better equipped to deal with stress. But what about the claims specific to cancer?
We'll delve into those specifics, but it's important to acknowledge that the research on ozone therapy for cancer is still in its early stages. There's intriguing preclinical evidence suggesting it might inhibit cancer cell growth, and a 2024 review article from the PMC, focusing on breast cancer, highlighted potential benefits, like its immunomodulatory and anti-inflammatory property.
Immunomodulatory, meaning it can influence the immune system's ability to fight cancer.
Precisely. Ozone therapy appears to activate certain immune cells that can target and destroy cancer cells. However, it's important to note that most clinical trials so far have focused on reducing chemo's side effects, not directly treating the cancer itself.
That makes sense, as those side effects can be incredibly debilitating for patients. But for someone seeking a true alternative to conventional treatments, that distinction is crucial.
Absolutely, and it's vital to understand that dosage and administration methods play a significant role in ozone therapy. The concentrations used in those promising preclinical studies are very specific, and exceeding safe levels could be toxic.
So definitely not something to try at home without expert guidance.
Exactly. There's also the issue of standardization in research. Ozone gas is notoriously difficult to measure accurately, which has made it hard to conduct large-scale, well-designed clinical trials. And this lack of standardization can make it difficult to compare results across studies.
While we're laying the groundwork with science, Dr. Schallenberger's interview also features compelling stories of patients who've experienced benefits from ozone therapy. He even highlights the work of Dr. Stuart Nunnally, a dentist successfully using ozone in his practice.
That's an important point. It shows how alternative approaches are gaining traction in certain fields. Dentistry, for example, often focuses on localized treatments, and ozone's antimicrobial properties can be beneficial in that context.
It does offer a glimmer of hope that maybe, someday, ozone therapy could become more integrated into mainstream cancer care. But before we get ahead of ourselves, let's dive deeper into the specific claims about ozone therapy in cancer, comparing anecdotal evidence with the limited clinical data we have.
Yes, let's analyze those cases, understand the benefits and drawbacks. We'll empower you with the information so you can have informed conversations with your healthcare providers. Because ultimately, it's about advocating for the best possible care, exploring all options, and demanding that science, not profit, drive treatment decisions.
Right. It's about demanding better for ourselves and for everyone facing this challenge. So let's take a closer look at what Dr. Schallenberger has observed when using ozone therapy alongside chemotherapy. What stood out to you in his accounts? One thing that really struck me was Dr. Schallenberger's approach of using ozone therapy in the lead-up to chemo. like prepping the body to better handle those powerful drugs.
Yes, he suggests this can reduce the severity of common chemo side effects, like hair loss, nausea, and fatigue. And while his observations are anecdotal, there's a scientific rationale for this.
I'm curious about that. How does ozone therapy potentially lessen those side effects?
Well, remember we talked about ozone's ability to stimulate the body's antioxidant defenses. Chemo often creates a lot of free radicals, which can damage healthy cells and contribute to those debilitating side effects. By bolstering the body's natural defenses, ozone therapy may help neutralize those free radicals and protect healthy cells.
That makes sense, but does it actually make the chemotherapy more effective at killing cancer cells?
That's where the evidence is less clear. While some small studies have suggested a possible synergistic effect, more research is needed to confirm whether this combined approach truly leads to better outcomes. In terms of tumor shrinkage or survival rates, the PMC article we mentioned earlier, while acknowledging ozone's potential to reduce chemo side effects, emphasizes that the data on its direct impact on cancer treatment is still limited.
So it's a promising path, but not a guaranteed game changer. And this is where open communication with oncologists is so crucial, right? It's not about replacing conventional treatments completely, but exploring how integrative approaches might complement them.
Precisely. It's about empowering patients to participate in their own care and advocate for a more holistic approach that addresses both their immediate suffering and indeed their long-term goals.
Speaking of integrative approaches, Dr. Schellenberger also touched on combining ozone therapy with other alternative treatments, like IV vitamin C and red light therapy. So much buzz around these, but it can feel overwhelming trying to figure out what to combine.
It's definitely complex, and while some practitioners, like Dr. Schallenberger, advocate for combining multiple modalities, others are more cautious. For example, there's some debate about whether antioxidants like vitamin C might interfere with ozone therapy's mechanisms.
So it's not as simple as just trying everything and hoping for the best.
Exactly. It's crucial to understand the potential interactions between therapies and to work with experienced integrative practitioners who can tailor treatment plans based on individual needs and the latest science.
Which brings us to a very real concern for many: cost and access. Realistically, not everyone has access to integrative clinics or the financial resources for these treatments. What can be done to address this?
You raise a valid point. Ozone therapy, like many alternative treatments, can be expensive, and insurance coverage is often limited. This highlights a problem within our healthcare system. Access to potentially beneficial therapies is often determined by financial means, not just medical need.
It's a frustrating reality, and it speaks to the need for a more equitable system that prioritizes well-being over profit. But are there any steps people can take to advocate for more integrative options and make these treatments more accessible?
This is where grassroots efforts become crucial. Patients and caregivers can become informed advocates, raising awareness and pushing for policy changes. They can also connect with organizations that are working to advance integrative medicine and make it more affordable.
So it's about collective action, raising our voices, and demanding better from our healthcare system. And speaking of demanding better, we need to talk about the potential dangers of ozone therapy if it's not administered properly. Dr. Schallenberger mentioned a case of a doctor who had his clinic raided by federal agents for practicing ozone therapy.
This shows the resistance that alternative approaches face, particularly when they challenge conventional medicine and the pharmaceutical industry. It's a reminder that those seeking alternative treatments often face legal and regulatory hurdles, and it underscores the need for more transparency and evidence-based regulation.
It's disheartening, but also a call to action. The more we educate ourselves and demand evidence-based approaches, the more we can push for a system that prioritizes patient well-being over profit.
Absolutely. And that brings us to a crucial point: distinguishing legitimate ozone therapy practices from potentially fraudulent ones. As with any new field, there are always those looking to exploit vulnerable people.
Right. It's essential to be wary of any claims that sound too good to be true or promise miracle cures. But let's shift gears a bit and zoom back in on what ozone therapy can offer. Dr. Schallenberger discussed its potential for a range of conditions beyond cancer.
Yes. He highlighted its use in dentistry, for infections and even root canals. He also discussed its potential to address autoimmune issues, which is interesting given your personal experience with toxic mold.
Exactly. He even suggested that regular rectal insufflations of ozone can boost the immune system, potentially warding off colds and flu.
These claims, while intriguing, need more research and should not be taken as medical advice, but they do point to the potential of ozone therapy to modulate various bodily systems, not just fight
Yeah.
cancer.
It's fascinating to consider how this one therapy might have such wide-ranging effects. But let's come back to the central question. What does all this mean for you, the listener, as you navigate the complex world of cancer care?
It means empowering yourself with knowledge, researching your options, and having open and honest conversations with your healthcare providers. It means becoming an active participant in your own healing.
And advocating for an integrative approach. That considers the whole person, not just the disease. It's about demanding that the latest science be considered alongside conventional treatments.
Because ultimately, it's about finding the best path forward, one that prioritizes both quality of life and the possibility of a positive outcome. And remembering that you're not alone.
There are communities, resources, and experts out there ready to support you. So let's delve into some key takeaways from what we've discussed, and then leave you with something to think about. Okay, so let's go over what we've learned about ozone therapy. It's a potential complementary treatment for cancer, but not a guaranteed cure. The science is interesting, but still in its early stages. More research is needed to determine how well it works and how safe it is.
And it's important to remember that ozone therapy isn't a one-size-fits-all. The dosages, the methods, even the types of cancer it might help with vary a lot. This isn't something to just try on your own. You need a qualified healthcare professional.
Right. Stick to the evidence. Talk to experts. And don't fall for quick fixes or miracle claims. But even if ozone therapy isn't the answer for everyone, this deep dive has shown us something crucial about cancer care.
It's shown us the limits of the current system, which often feels like a one-size-fits-all approach. It makes you wonder, what if we had a system that was truly patient-centered, where the focus wasn't just on killing cancer cells, but also on supporting the whole person, mind, body, and spirit?
Imagine a system where new science, like ozone therapy, was readily embraced and studied. A system where integrative approaches, combining the best of conventional A&D alternative medicine, were available to everyone.
That's what we need to strive for. And it starts with us, with patients and caregivers demanding better, pushing for change.
It's about advocating for more research, more transparency, and a system that cares about outcomes more than profit. It's about knowing the facts and speaking up.
If enough of us demand better, who knows what we can achieve? This look into ozone therapy is just one example of what's possible when we challenge the way things are and push for a better way.
So what does this mean for you? On your cancer journey, it means taking charge, staying informed, and never giving up hope. It means doing your research, asking the hard questions, and finding healthcare providers who understand your needs and goals.
It means remembering you're not alone. There are communities, resources, and experts ready to help. Talk to them. Share what you're going through and join the movement.
Because it's about creating a future where innovative treatments, backed by science, are available to everyone who needs them. A future where cancer care isn't just about survival, but also about living well, living a life with purpose and joy, even through the tough times.
And as you continue on your path, I'll leave you with this. What if the true power of ozone therapy, and other therapies like it, is not just their effect on cancer cells, but their ability to change how we see health and healing, a shift from just focusing on disease to a truly holistic approach, where the goal is not just to get rid of illness, but to create well-being in every way.
That's something to think about. Thanks for joining us on this deep dive. Until next time, stay curious, stay informed, and stay strong.